and I'll try not to duplicate what Dr. Boyle said. In the U.S., there are over 200 drugs that are used for cancer treatment. Unfortunately, there are some of them that actually cause cancer, birth defects, miscarriages, immunological damage to healthy people when they're accidentally exposed. And this is where we have a big concern. We have known since the 80s that nurses who are accidentally exposed have severe effects, as Dr. Boyle had mentioned. They develop cancer. They develop breast cancer. They develop colorectal cancer. They develop, there's evidence coming out on bone cancers. And so we have spent a lot of time in the medical industry working on how to protect them from the excreted. It's not just before the drugs are given, it is after the drugs are given, because the patient's body, there's 27 of them that the patient's body cannot metabolize and excrete it. And as we heard, it comes out in the urine, the feces, the vomit, the sweat, and saliva. And it comes out in the 1 to 2 days, usually after every infusion. If we can control those excretions for that period of time, we can actually protect people. It used to be that we assumed, the patients were confined to the hospitals and it was managed. But now we are sending it home. It is better for the patients to go home right away. It is less expensive for them to go home right away. But we are not having the protective equipment and the protective procedures follow the patients home. And unfortunately, we are seeing data that's coming out where not only are the cancer patients excreting these drugs, but we're finding that the spouses of the cancer patients are actually excreting drugs at higher levels than is found in the urine of the nurses back when we were not minding the situation. And from the 30 years of human studies, we know that healthy people exposed for these drugs will get cancer, birth defects, miscarriages, and all types of issues. And there is this question, and the other thing is, not only is it right in the house that you have the exposure, is these 27 drugs cannot be cleaned out by wastewater treatment or drinking water purification technology, any technology that we have today. For example, greater than 98% of cyclophosphamide and isophosphamide, which are two cornerstones of breast cancer treatment, pass through all wastewater treatment and drinking water purification that we have. If it is flushed down the toilet, it is going to end up in our groundwater, and this is a real problem if you're on a septic system and have a well, because it is going to be there. And we know from scientific data that it exists in the soil for years. So we've got to maintain it. Now, yes, there is a real serious question about cost. Well, I can't address, there is a lot of work. There's been suggestions about these various stewardship programs. And that is a possibility. But I can tell you very clearly what happens, this expenses, when we don't control it. Cancer treatment for every patient, every family giver who is exposed and gets cancer, on average is $185,000 for treatment. But there are two cancers that my background is drug development, and I will tell you that the best way to treat cancer is to prevent it. But there are two cancers and pediatric cancers that the #1 cause is exposure to chemotherapy. That's acute myeloid leukemia and acute lymphocytic leukemia. Those children, when they get it, it is 2 to 3 years of extreme chemotherapy. And then in 1/4 of the pediatric patients with ALL, and it's 1/3 of those with AML must have a bone marrow transplant. Bone marrow transplants cost $800,000 as a minimum if there is no complications. If there are complications, you're talking $2 to $3 million. Even with all that treatment, 1/10 of the children with ALL will die. And it is almost 30% of those with AML will die. And these children have gotten it from exposure to chemotherapy. That is what we are trying to prevent. It is a very low cost relative because it's only a short time that we must manage the waste. But if you don't manage the waste and you develop cancer, especially a young cancer, it is incredibly expensive to treat. And is right now is I think it's something like 80 to 85% of patients are treated as an outpatient. It is better for the patient. No two ways around it. You do not want a sick patient in a hospital. It's also psychologically better for them to go home. But a lot of their care actually falls onto their caregivers. Family members are so critical to a cancer patient's treatment. Absolutely. Anybody who's ever supported a family member going through chemo knows what we must do for them. These are the people that this bill is trying to protect. We are trying to give the cancer patients the best care, but we don't want them to feel that by taking care of their family member or having their family member take care of them, that they are putting their family member at risk.
I will let you know that we've heard this bill